All right, welcome everyone. In this session, we're going to do a quick revision of the key homeopathic remedies for diarrhea. So let's just jump right in.
Okay, first things first, and this is probably the most important thing to remember, our guiding principle. We don't just prescribe a medicine for diarrhea. It doesn't work that way. The remedy selection is always based on the complete picture of all the individualizing symptoms. So the real takeaway here is we treat the patient, not the name of the disease.
So here's a quick look at our game plan. We'll start with remedies grouped by what caused them, then we'll look at remedies known for the sensations they produce. After that, we'll cover a few other important ones, talk about supportive care, and wrap up with the really crucial part, when you need to see a doctor.
All right, let's kick things off with our first section, remedies grouped by cause. We're going to start by looking at remedies based on what actually triggered the problem. Figuring out the cause is a huge first step in finding the right remedy for that individual. Now, probably the most common trigger you'll see is, of course, what we eat and drink. Let's dig into how very specific foods and drinks can point us directly to specific homeopathic remedies.
Okay, take a look at this table. This really shows the kind of precision we're aiming for. So if the issue is triggered by rich, spicy food, and there's that classic ineffectual urging, your mind should immediately go to nux vomica. If it's from fatty foods like pastries, especially if the patient isn't thirsty, you're thinking pulsatilla. And look at how specific this is. Diarrhea after boiled milk points to sepia. And of course, for food poisoning cases with thirst for just small sips, arsenicum album is your key remedy.
But the trigger isn't always physical, right? Our mental and emotional states, and even just plain exhaustion, can be a direct cause for an acute episode of diarrhea.
When it comes to emotional triggers, we've got some key differentiators to look out for. If anger is the cause, you have two main remedies to think about. First, there's chamomilla, which is perfect for those super irritable teething kids. Then you have colocenthis, also from anger, but the big giveaway here is severe colic that feels better with pressure. And then there's diarrhea from pure mental burnout, where it goes on for a while but doesn't cause weakness. That's when you consider acidum phosphoricum.
Okay, moving on. Let's talk about environmental and travel-related triggers. Sometimes it's not what you ate, but more about where you've been or what you've been exposed to. And here, we've got two super clear-cut remedies. For a really sudden onset after being out in a cold, dry wind, especially if there's anxiety with it, you think of Aconitum nepalis. And for diarrhea that's specifically caused by traveling, in cars, buses, trains, the remedy is Cocculus indicus. Simple as that.
All right, let's dive into our second section, remedies by sensation. How the patient actually feels is one of the most important clues we have for individualizing a case. So let's focus on remedies that are really identified by their unique physical sensations. What is the patient telling you?
Now, this is a really important comparison to grasp. With colocenthis, the key is that severe cutting colic that gets better from bending over or applying hard pressure. Lycopodium, on the other hand, has this very strange and unique symptom, a feeling of chilliness right in the rectum before a stool. And you always have to remember its key time modality. Symptoms get worse between 4 and 8 p.m.
Let's run through 4 more really key sensations you need to know. For Royum, the keynote is shivering that comes with a sour-smelling stool. For Ratrum album, you're thinking of an extreme coldness of the entire body, coupled with profound weakness. Croton tiglium is your go-to when the stool just gushes out, suddenly and forcefully. And finally, the hallmark of allosocotrina is that lack of control, where stool slips out involuntarily, even when just trying to pass gas.
Okay, on to section 3, other important remedies. Let's have a look at a few more remedies that are known for their very unique constitutional pictures and some really specific indicators.
So the big indicators here really come down to timing and constitution. If the patient is literally driven out of bed by diarrhea first thing in the morning, that is a classic sign for sulfur. If the diarrhea happens only during the day and never at night, you need to think of petroleum. And calcarea carbonica is for chronic cases in those fat, flabby individuals who often have strange cravings for things like chalk or dirt.
All right, that brings us to section 4, supportive care. And this is super important because alongside the right remedy, these supportive measures are absolutely crucial for a fast recovery.
It really boils down to 3 simple rules. Number 1, hydrate. You have to drink an ORS solution frequently to keep dehydration at bay. Number 2, a light diet. Stick to really simple foods, things like khichdi, bananas, curd rice. And number 3, avoid. Just stay completely away from anything spicy, oily, or from outside until you are fully recovered.
And one more thing. You can also use biocombination number 8 as a general biochemic support. It's something that can be taken right alongside the main indicated remedy, and it really helps aid the whole recovery process.
And now we come to section 5. And listen, this is arguably the most critical part of this entire discussion. Knowing when to see a doctor. These are the red flags that you just cannot ignore. They are non-negotiable.
So before you even think about continuing with any home treatment, you have to stop and ask yourself this one critical question. Is this a simple case for self-treatment, or is it a medical emergency?
Okay, you absolutely must pay close attention to these red flags. You need to seek immediate medical help if there is any blood in the stool, if there's a high fever, if vomiting just won't stop, if you see any signs of severe dehydration, or if the diarrhea itself lasts for more than 24 to 48 hours. And please, always remember, this information is for revision. It is never a substitute for professional medical advice. The question to leave you with is, are we always paying enough attention to these critical warning signs? Thanks for watching.